Welcome back to Healthy Fit and Fab. I'm Dr. Chybar-Virgo. If you've watched part one of this series, you now have a better understanding of what type 2 diabetes is, its symptoms, its risk factors, and complications. But understanding diabetes is only the first step. In this video, we'll be diving into the most important part, what you can do to prevent or manage diabetes and its complications. Whether you're trying to delay the onset of diabetes or stabilize your blood sugar levels or simply feel more confident about your health, these practical steps can help you take charge of your journey. So let's get started. All right, let us talk prevention. We already mentioned that just because you have diabetes or may have been diagnosed with it does not mean that there is nothing that you can do about it. And so if you're thinking about reducing your risk for diabetes, right, or preventing it, have to look at the risk factors that you can change. So again, here they are on the screen: overweight or obese, unhealthy diet, gestational diabetes, physical inactivity, smoking, high blood pressure, high cholesterol, history of prediabetes. So we know what it is that we can change. Now, that means we can use that to guide us on what can we do to prevent ourselves from getting type 2 diabetes. All right, so someone said they scored 3 on the preventative thing. That means you're low risk. But even though you're low risk, you will see that they gave you some suggestions, because just because you have low risk does not mean things can't change in the future. So prevention, taking the preventative steps as we're about to talk about now, is good. Awesome. Thank you so much. All right, now we are going to look at the preventative measures. Okay, so maintaining a healthy weight, as we mentioned, that accounts for 80% of persons with type 2 diabetes, is for those who are overweight. So maintaining a healthy weight is extremely good. Even just losing by 5 to 10% of the weight has shown to reduce the risk factor of a type 2 diabetes, has shown to improve blood sugar levels as well. So that's a significant preventative measure right there. Maintaining healthy eating habits as well. So that is also key, because a lot of our sugar control does come from what we eat as well. So feeding our body with nutritious foods in the right proportion size as well. So it's a balanced, nutritious meal, right? So for example, what some nutritious foods are: fruits, vitamins, whole grains, right? Peas, beans. Those are like foods that are high in fiber, and they're also high in vitamin and minerals as well. Then you're thinking about your protein, lean protein. It's getting some fish as well into the diet. And in terms of healthy fats can come from fish, nuts, seeds as well, pear. And we know there's a lot of pear in Jamaica as well. However, while thinking about all of this, just be mindful of portion size. All right, so those are some ideas of things that you'd want to improve or have more of. And the things that tend to cause were harder to manage your blood sugar levels are things you may want to limit. So some of that can be the highly processed foods. So like fried foods, the packaged chips, sugar-rich beverages as well. Those can cause the sugar levels to be extremely high really fast as well, making it harder to control. Staying adequately hydrated is also important in prevention and management as well. It's a part of the overall diet. Being physically active. And sometimes we hear exercise or physically active, we're thinking a whole hour of exercise, and it becomes overwhelming. But as small as 30 minutes, 5 times a week of brisk walking, some studies show that can actually decrease your risk by 50%, by half. So start small, gradually work your way up, right? Sometimes when we think about making changes, we think about the big picture, which is good, but sometimes we have to start small and gradually work our way up. Next is adequate rest and stressing less. Now, in today's world, unfortunately, there is no shortness of stressors. There is less sleep, right? Because more things to worry about, more things to do. Unfortunately, having that chronic stress and sleeping less can also impact your blood sugar management. It can make blood sugar levels get higher, can make it harder to control, it can increase body fat as well. And so it's just one and the other. So all I'm asking is to think about how can you get adequate sleep, 7 to 9 hours of sleep, 7 to 9 hours of sleep per night, and what can be done to have more self-care. Even 10 minutes a day, right? Even 10 minutes a day can make a difference to terms of self-care. So good stress management is key.
Want to think about, do you have any bad habits like drinking alcohol or smoking? Now, alcohol, especially in excessive amounts, can affect the pancreas, and we spoke about the pancreas as the organ that produces the insulin. So, want to make sure you're protecting it as well. Can cause other problems too. So, it's not about cutting it out completely. It's more about drinking it in moderation. And you can talk to your doctor about what is okay for you. Smoking itself is big risk factor, and usually we say quit smoking. And if you're someone who does smoke, talk to your doctor about resources and tools that can help you to quit smoking, because we know that quitting something like smoking can be very hard. So talk to your doctor, reach out to them to find that resource for you to help you on that journey. As we mentioned, doctor, following up with your doctor, going to your checkups, and following your doctor's advice is very crucial as well. Again, even if you don't have diabetes, even if you feel amazing, still want to get your doctor's checkup. Right, it's really good to get your doctor's checkup because you're able to go in there and doctor can take a look at your risk factors, find out if there's anything that they need to check on for you more frequently, if any advice they need to give you that's a little bit different. So it's really good there. And if you already have diabetes, even more you want to make sure you're staying close to your doctor and following their advice. Manage underlying conditions. We mentioned how high blood pressure and high cholesterol can affect diabetes as well and cause high blood sugar levels. And so one of the things that we want to make sure is that we're properly managing and that taking our medications, talking to our doctors about that as well. Now, other management, this is for those who do have diabetes, is want to take, so before this was the preventative measures for preventing developing diabetes and also preventing complications if you already have it or just to maintain better management of it. Now, other management is if you already have diabetes, taking your medication as prescribed is very important. There are different types of medication that may be given. Maybe we give insulin because your body's lacking the insulin. Maybe we give a medication that can help the body to use the insulin better. So there are different medication. You can talk to your doctor as well about the different types if you have any questions. And there's also regular monitoring of your sugar levels. That is very important because it's telling you something, telling your doctor something. So keeping check of that will be able to tell your doctor, might be able to say, hey, you're doing really well. Maybe we can cut down on the medication. Or maybe there's something we need to change. We need to step up a little bit. So it's crucial to be aware of what your sugar levels are like. Inspect your feet daily. Very important. Remember, I told you that there are some circulation problems that can occur with diabetes and nerve issues too. So sometimes a little cut on the foot, you may not realize it, and it can become infected if not treated properly, and it can spread. So you're looking for bruises, sores, scrapes, cuts, some redness. There are some things to take a look at too. It's important to know the symptoms about low blood sugar is because a person with diabetes can experience low blood sugar and that can be very dangerous. So talk to your doctor about low blood sugar and if anything as well. Sometimes if you're feeling it or you realize your blood sugars are low, you may need to take something sweet as well. You can also check the sugar levels and it may also mean you have to rush to the hospital to get treated. So these are just some symptoms of what low blood sugar might look like. So you might see sweating. So you might see sweating, paleness, hunger, fatigue. It means you're feeling a bit tired, feeling anxious. Maybe you feel like your heart is racing, or feeling a lack of concentration. Joining today, you got the knowledge, right? So that's the formula for a successful diabetes management is I put together a little formula. It's knowledge, which you'd have had before, and then you got a little refresher today. And it's also following up with your doctor, getting a personalized plan from your healthcare team. But is there something else that's missing to help for a successful management of diabetes? You know what that is? Taking action.
Taking action is a huge step, and sometimes can lead persons to feeling overwhelming or frustrating at times, especially if you're worried about your blood sugar levels. You may have found yourself wondering what foods can you eat safely without causing blood sugar spikes, or skipping meals to try and balance out your blood sugar levels, or even fearing that your diagnosis means giving up your favorite foods forever. These challenges can leave you feeling hopeless and defeated. And the thing is, you're not alone. Many do experience this. But the good news is that it doesn't have to be this way. In my next video, I'll be sharing some practical tips to help make healthy eating easier for persons struggling with their blood sugar levels. We'll tackle those fears to help you feel more confident about your food choices and help you enjoy eating again. So be sure to hit that subscribe button so you can know when that video is out. And before you go, please let me know in the comments what's that one challenge you're faced with managing your blood sugar levels. your experience could help others who are feeling the same way. And if you found this video helpful, please give it a like. It helps more people find this information. Thank you so much for watching. We'll see you soon. Be well and stay safe.